If we were at a treatment program, you kind of eat when they give you food or when you're scheduled to eat and not otherwise. And when you leave the program, I felt it was a smart thing to sort of retain that structure, not because I wanted to have a rigid life and have to do that for the rest of my life, but because I couldn't be trusted. I didn't feel that I could trust myself yet. And if I didn't have a solid structure, I might fall into urges.
Sure.
If someone is trying to sort of get themselves on a regimen so that they can, fix the kinks in their eating, what would you suggest to people who are not able to go to an inpatient or residential program, or maybe don't have quite that level of need?
So I do think 3 meals and 3 snacks are the way to go, and the nutritionists that I've worked with say that's a rule for everyone. So our blood sugar tends to start dropping about 3 to 4 hours after we eat. So if you've got breakfast, snack, lunch, snack, dinner, snack, right? Probably the biggest period of time that you'll have in between eating is dinner and snack, depending on if you're a European late eater, Most people, after a while, end up dropping the night snack. So it's breakfast, snack, lunch, snack, dinner, right? You can move dinner a little bit later. You want your blood sugars to remain as stable as possible. That would be a goal. And you want to be able to plan ahead to where it's easy to get to, that you can get to a snack easily, or you've thought ahead about meals. I think it's important to have the structure. You can set alarms on your phone to remind you, like set them a half an hour early so you have the time to prepare a meal. I do think it's important to meet with a nutritionist who specializes in the treatment of eating disorders, because most have far more training about weight loss than weight restoration or weight maintenance if you have an eating disorder. So to meet with them and get a meal plan, but not have to go every week. So if you're talking about the people who are trying to make ends meet, maybe their insurance doesn't cover it or they don't have it, at least go to that one assessment and maybe one follow-up session, get a meal plan, and then follow it as best you can.
And then in terms of worksheets, or things to do if they're having urges outside of that meal plan, what's a recommendation for how to navigate those urges?
A couple of things. I would sit down and try to journal about, is this head hunger, heart hunger, or belly hunger? So if I skipped my morning snack, it may very well be belly hunger. If I'm eating, and I've been pretty consistent about eating, and I'm having a hunger cue at the moment, is it head hunger, like am I confused about something? Is it heart hunger, like I'm sad or I'm angry about something? To stop what you're doing and give some time and thought and consideration to what else could it be. With consistent eating, meal, snack, meal, snack, meal, snack, you will reestablish your hunger cues. It will happen. People lose their hunger cues because the body kind of gives up. It's like, well...
How long does it take to reestablish hunger cues, would you
if
say?
You're 100% consistent, I would say less than 2 to 3 weeks.
Really?
Yeah. Now, I'm sure that's not for everybody. It's a rule of thumb, but within 2 to 3 weeks. And can I also say that if you are a restrictor within an eating disorder, hunger cues are frightening. Remember, it's not about not wanting the food, it's about not wanting to want it. And that hunger cue means I want it, or my body does. And that could set up, well, now I'm mad at my body, as if my body were something other than me. Make sense? So hunger cues are frightening.